back, everyone. It is Gastroesophageal Reflux Disease Awareness Week. We have a panel here of experts to talk about that. Registered dietitian Melissa Prichard with Summit Medical Group, and John Haydek is a gastroenterologist with Gastrointestinal Associates. Good afternoon.
Hello, Maura. Hello.
Hello. I'm so glad you all are here. I know that, let's talk about, first of all, what this is. The short name is GERD, I think. But tell me what exactly we're talking about.
GERD is where acid and other contents come out of your stomach into the food tube and then cause symptoms. There's something called heartburn, which is similar. Heartburn is more of just a symptom of acid coming up, but GERD is where that symptom now starts to control your life enough to where you adjust your diet, have to take medicine for it.
Can it be dangerous? I mean, are there any lasting effects of it, or is it just uncomfortable?
Most of the time, it's just a bothersome symptom, but it can lead to bad things like scar tissue with trouble swallowing, or an abnormal tissue called Barrett's esophagus, which could be precancerous.
So how do you, as the physician, treat this?
Well, I guess you always try to do the simple things first, and most reflux can be taken care of with very simple maneuvers. Maybe maneuvers we don't like to do, like not eating as much, small frequent meals, and I think Melissa will probably tell us some more things about that. But thank goodness nowadays there's medicine that we can use that'll give people back their quality of life.
So, Melissa, let's talk a little bit about some of the dietary and other changes that patients you work with can make that are helpful to them.
One of the biggest things, as Dr. Haydek already mentioned, is not eating big meals, and that's probably the hardest thing to do this time of year especially. So we sit down with a plate of food, and one of the things I remind my patients of is your stomach is only the size of your fist.
Yeah,
so if you're eating a big plate of food and trying to stick that in your stomach, it doesn't always work well, and that's where that reflux will start to happen again. So that's one of the big ones. Another one is avoiding spicy foods and high-fat foods. Things like, eating white meat instead of dark meat can help a little bit. Trying to avoid the skin on the turkey, staying away from maybe the sweet potato hot dish with the extra butter and things like that. Trying to stay away from some of that extra added butter.
Interestingly, these are things that are healthy changes anyway.
Yes.
Which are probably things you talk about with all your patients.
Yes, absolutely.
So if you make some of these lifestyle changes, like especially diet, can people, oftentimes see significant progress without medication?
The vast majority can do it without. It's when they try those changes and it doesn't work, they really shouldn't suffer. They should see their medical provider, because there's lots of other, there's surgery that can sometimes be done to cure them of their condition. There is medicines, and sometimes it just takes a good authoritative figure like a doctor to say, gosh, sir, you really got to do your part because you don't want to have these bad complications happen. And sometimes it just takes an authoritative figure, not a spouse or a son or a daughter, but actually someone like a physician to help them get them back on track.
So first step, if you feel like you're having some of these symptoms, is to see your doctor.
To see your doctor, talk to them. You can always use something over the counter. There's lots of things like Pepsid or Zantac, which works, or just simple antacids. But if you're noticing that you're having to take those more and more frequently, it's better to talk to someone than to just try to treat yourself.
All right. And then finally, it is Thanksgiving.